Now let's dig into the details where we stand with our Chief Actuary, Donna Glenn, with the State of the Line report. Donna and her team have worked through an extraordinary year, so I know that she's come with some unique insights to share. Donna?
Thank you, Bill. You talked about the purpose of workers' compensation, and it really is a noble purpose, our focus on helping injured workers. What's also noble is the character of the frontline workers. Their incredible courage and commitment to their jobs was extraordinary in 2020. And I have an NCCI shout out to all of them. To those in healthcare who help us achieve our purpose, nurses, nurses' aides, orderlies, doctors, therapists, and so many more. And to the essential workers who have supported the country in so many ways, keeping food in our stores, keeping deliveries coming to our homes, and keeping our social safety programs running. So did you know it's Nurses Week? So here's a double shout out to all the nurses across the country. So be sure to hug your favorite nurse this week. We've learned so many lessons in 2020, and one of them is extraordinary resilience. And as Bill said, the workers' compensation system has been resilient too. We feared that the pandemic could be devastating for the workers' compensation system, and it has not. In part because the system is so strong, as you'll see today. In part because our social systems are working in coordination. Employers have modified the way they're handling worker challenges through modified duties, through sick time for exposure cases, as well as mild infections. We've had government assistance for the unemployed, for families, and for businesses. And regulators have responded to ensure that specific workers have coverage. It's evidence that we are stronger together. I stood here a year ago describing the uncertainties ahead in 2020, and we continue to have uncertainties in 2021, but we have fewer of them, and we have more optimism for recovery. Plus, we have renewed confidence about the system's strength and resilience. The greatest impacts in workers' compensation are on the exposure side, premium. And this is reflective of the millions of Americans who lost jobs in 2020. And on the loss side, we have an offsetting impact of fewer typical worker injuries and an influx of COVID-19 claims. And no doubt, we are learning a lot, and we are adapting. For example, as employers and risk managers, you may wonder when normal will return, how to safely get people back to work, and when will demand for discretionary services come back. As underwriters, you may wonder how to adjust for future pandemic risks, which classes of business are more at risk, and loss control experts, how to manage and control that risk. And as regulators, you may wonder what's the right approach on presumption. Claim adjusters, you may wonder how to best care for the workers with long-haul symptoms. And actuaries like me stay awake at night wondering what to look for in the data to ensure we have accounted for all of the anomalies. And if we listen, learn, and collaborate, we are dealing with these and other issues, and we are emerging stronger together. So today, as I discuss the state of the line, we're going to do something unexpected. I'm going to give you the key financial highlights up front, and then we'll explain the context, share trends, and help you understand what it all means. Plus, we'll also identify a number of watch list issues that describe some uncertainties for the future. So first, net written premium is down by 10%. We have strong results with a calendar year combined ratio of 87% and a reported accident year combined ratio of 100%. Our overall reserve position for private carriers is even stronger than last year at $14 billion. And our first look at COVID-19 losses for NCCI states, inclusive of private carriers and state funds, we see $260 million. And loss drivers, which exclude COVID-19 claims. Frequency is down 7%, indemnity severity is moderate of 3%, and medical severity is a bit more challenging, and we're calling it plus or minus 2%. So today, I've lined up some talented NCCI colleagues to join me in this year's State of the Line and drill down into a few areas. Len Herc will look into the economic drivers of 2020 and what is likely to come in 21. Nadej Bernard-Arens will share details on the COVID losses that we've seen to date. And Sean Cooper will look at the legislative landscape, both current status and what might be ahead. We expect you'll have many questions, so please use the Q&A box throughout the discussion. I'll be joined by my 3 colleagues in our Q&A session, and we have a full 30 minutes to get to as many questions as possible. Let's get started by jumping into workers' compensation premium. And as I mentioned, our financial highlight here is net written premium declined 10%. In this historic view, we showed the private carrier in blue and the state funds in orange. Both experienced similar declines. And for 2020, private carrier premium is $38 billion, and after including state funds, the 2020 total is $42 billion. So we saw drops of this magnitude back in 2008 and 2009 as a result of the Great Recession. What's notable with the Great Recession is the prolonged length. The decline happened over a 2 to 3 year period, followed by a 4 to 5 year recovery period. So clearly, the 2020 COVID recession is so very different. Different catalyst, different intensity, and very different in our recovery expectations. Nonetheless, as 2020 came to a finish, we're not surprised by the 10% decline in premium, since the employment drop was so severe in second quarter. For the residual market, we've seen a gradual decline in premium since 2015. This coincides with the years of strong profitability in the voluntary market. So here, a decline signals that the risks continue to find coverage in the voluntary market. And premium in the NCCI service pools is now less than $1 billion for the last few years. It's currently $800 million for 2020. And from a market share perspective, you can see that 2020 is a continuation of the recent decline to the current market share of 6.5%. It's very stable and very manageable. Now let's switch back to direct written premium for the private carriers. Similar to net written premium, countrywide direct written premium declined significantly between 2019 and 2020, with a decrease of 8.7%. And the magnitude of this decline varies a little bit by state. As you can see, most states are in blue, showing a premium decline. The deepest blue color signifies the deepest declines, minus 18% in a few states. And the lightest colored states had a slight positive change in direct written premium. So the premium decline is a direct result of the COVID recession. So now I'll bring in Len Herc, NCCI's senior economist. Len, we lost millions of jobs in early 2020, and we had seemingly opposite forces at play throughout the year. Efforts to contain the virus and efforts to open up the economy. So let's describe our employment gap analysis and show what we've seen over the last 12 months or so.
Hi, Donna. A key theme of the COVID recession is job losses and their recovery. The employment gap measures COVID-related job losses as the difference between actual employment and the expected level of employment under non-COVID conditions and includes seasonal variations. A year ago in spring, the first wave of the virus, it was mild in retrospect, triggered widespread stay-at-home orders and business lockdowns. In the span of about 6 weeks, starting in March, the U.S. employment gap went from 0 to a shortfall of 16%. And by mid-April, 1 out of 6 private non-farm workers was out of a job because of COVID. That's a total of 21 million lost jobs nationally. The pandemic subsided briefly, and then a second surge hit in July with case rates 2 times higher than those in April. But despite growing COVID case rates, economic activity adapted and employment recovered. By September, the national employment gap had diminished to half of April's peak, But even so, one out of 12 workers was out of a job. That's 10 million lost jobs nationally. In some states, the third COVID surge started in October. It intensified from November to January throughout the country. COVID cases in December were 7 times those that shut down the economy the previous April. During the winter, job recovery stalled out, but apart from a tremble in December, did not reverse. The national employment gap was nearly stationary from October through January at between 8 and 9 million lost jobs. Let me pause here for a moment to emphasize an important point. Notwithstanding intensification of the COVID pandemic, the U.S. economy recovered lost jobs from April through year-end. This observation holds true for every major economic sector and in every state. So the point is this: the sensitivity of job losses to COVID case rates diminished markedly as the pandemic progressed, and even before the advent of new vaccines. Looking forward, in 2021, things began to change. Distribution of the new COVID vaccines started in January. COVID case rates dropped by half in February and fell further in March. Hiring picked up in February and March. And the most recent jobs report shows that the employment gap for April held steady, very close to what we saw in March. Now, while these numbers aren't so very different from January, the big change from last winter to now relates to expectations. And so far, 2021 feels different than 2020. The vaccine rollout and the drop in COVID case rates kindled a sense of optimism and an expectation that the COVID recession may be over by year-end, perhaps sooner. And expectations drive behavior. As people feel more comfortable about resuming activities they had deferred for fear of COVID, think of leisure, travel, but also major purchases like a new car, then businesses can feel comfortable restoring normal levels of operation. So a widespread expectation of economic recovery boosts demand and supply together, and that expectation is driving the hiring surge that started in February and continues today. Now, I say that even in light of the April jobs report. It's being described as a big miss, but I think it's actually less surprising and I believe less worrisome than you might have heard.
2021 indeed feels different. There's so much positive energy, hope, and optimism for a strong and rapid recovery, despite the surprise in the April jobs report last Friday. I think our audience will want to hear more about your perspective on the April numbers. We'll dedicate a few minutes of our Q&A on this topic. So the story on workers' compensation exposure is about payroll. It's about the number of people working, as Len just described, and the wages, how much they're paid. And with all of the job losses in 2020, the payroll number here may surprise you. We're reporting a small positive increase. So let's walk through what happened to create this odd outcome during a massive recession. So Len, take us through the employment side first.
Sure, Donna. The bars on the chart show average percentage job losses in major sectors of the U.S. economy. Let me emphasize that the job losses shown here are averages for 2020. Job losses of today are lower. During 2020, COVID job losses were especially severe in the big four service sectors, shown here in blue. And by a wide margin, leisure and hospitality was the hardest hit of all sectors with an employment gap of 22%. Now, the big four service sectors contributed 80% of all job losses during the COVID recession to date. That's 4 out of 5 lost jobs, and that figure has been very stable from month to month. Each of the big four service sectors lost a significant percentage of jobs, and in addition, these sectors account for about 2/3 of U.S. employment. That's a lot of people. The big four service sectors comprise a variety of services, many of which involve high physical proximity and whose consumption is discretionary. And when I say discretionary, I'm referring to activities that are not immediately urgent and can be postponed. The other sectors collectively contributed the remaining 20% of job losses. To pick two of particular interest to workers' compensation, construction and manufacturing both experienced significant percentage job losses during 2020 on average. These are shown in the purple bars. But because the national employment shares of these sectors are relatively small, they contributed only a minor share of all lost jobs during last year.
It makes sense. I think most people can relate to this employment story in some way or another. Now let's talk about wages. We see here that the wage impact for 2020 is plus 7.4%. It pretty much offsets the employment impact to payroll. It's a bigger number than we've seen in prior years, and it's a bit of an anomaly. Let's explain that next.
The big jump in average weekly wages is indeed an anomaly, or an anomaly. But the increase is more apparent than real. In fact, the greater part of the more than 7% increase in wages is driven by job losses, more specifically by which jobs were lost during the COVID recession. Let me explain. As we saw, 80% of lost jobs came from the Big Four service sector. These sectors employ a lot of workers in low-skill and low-wage jobs. What this means is that COVID-related job losses are strongly concentrated at the low end of the earnings spectrum. Now, to be more specific, with the exception of a few high-earning professional services, we estimate that job losses in the Big Four service sector paid on average $34,000 annually. In leisure and hospitality and retail trade, the number is lower. Lost jobs there paid on average only $25,000 per year. That's not a lot of money.
No.
So the jump of more than 7% in the average weekly wage wasn't because workers all got big pay raises last year. It's instead because mostly low-wage workers lost jobs. This is a distributional or a mix effect. Dropping low-wage workers out of the employment pool or mix pushes up the average wage among those workers who remained employed. Indeed, we can separate the overall increase in the average weekly wage into two components. We estimate that the average annual wage increase to workers who remained employed last year came to 3%. This is almost identical to what we experienced in 2019, the last pre-pandemic year. The remaining 4.3% is the mix effect. It's the change in the average weekly wage attributable to the disproportionate share of job losses among low-wage workers.
So that's the big picture for employment and wages influencing overall payroll for workers' compensation. So you mentioned earlier that there are similarities and differences by industry sector. Let's talk about the most challenged industry, leisure and hospitality, and share our analysis that has deeper insights by state.
With 40% of national job losses, the leisure and hospitality sector has been by far more impacted than any other part of the economy and has really become emblematic of the COVID recession. The leisure and hospitality sector is more than just cooks, bartenders, and waiters. It also includes people working at hotels, movie theaters, gyms, spas, recreational centers, sporting venues, as well as travel agents, performing artists, and numerous others. Let's take a look at the map first. The states that suffered the biggest losses of leisure and hospitality jobs, those shown in the two darker shades, are in the Northeast and Midwest, roughly a band from Maine to Minnesota. They're also on the West Coast, with the addition of North Carolina, Alaska, and Hawaii. States which experienced milder job losses, those are the two lighter shades, are mostly in the southern tier of the U.S. and the Mountain West. Now let's move over to the chart on the left. Two observations are worth noting. First, for every state group, the time path of job losses is similar. Huge job losses in April and May, but followed by recovery to year end. And second, state groupings were established early on. The lines don't cross. States which suffered the biggest job losses in April remain those with the biggest job losses in December, and vice versa. In fact, these two observations are common to all sectors, not just leisure and hospitality. And both are actually quite remarkable, given the very different COVID experiences of different states during 2020 in terms of the pandemic's timing and intensity. But two things really stand out for leisure and hospitality. First is the sheer magnitude of job losses throughout 2020. In April, employment gaps averaged above 40% in the two least affected state groups, and were above 50% for the two most affected groups. Second is the scale of interstate variation at year end. As of December, leisure and hospitality job losses still averaged over 20% in all states and were above 40% in the states most severely impacted. Now, for other service sectors like education and healthcare and the sector comprising a lot of business services, employment experiences over time and across states were similar to that for leisure and hospitality, though generally less severe.
So looking ahead for the remainder of 21, we see some fuel for greater recovery in this industry. We actually have a greater percentage of our country that's vaccinated at this time than many of us expected. And we have pent-up demand to resume more normal leisure and entertainment. I want normal back. Personal travel has also started to rebound. I think we hit record highs actually today in the airports. And it's encouraging for 2021. So let's talk about construction. It's a great contrast to leisure and hospitality. It's a big workers' compensation sector as it drives a lot of premium into the system. It has fewer challenges with respect to physical proximity, and it's often outdoors. So let's highlight our construction insights next.
The COVID employment story for construction is very different than that for service sectors like leisure and hospitality. Now, having just said that, let me touch on a couple of similarities first. Overall, the most severe job losses in construction happened in spring with recovery thereafter, although this effect was most evident in the two most severely impacted state groups. And as we saw with leisure and hospitality, state groupings were established early on. That is, states with the most severe construction job losses at the beginning of the pandemic remained the most severely impacted at year-end, and vice versa. Now, here are the two big differences. First, job losses in construction were generally much less severe throughout the pandemic. For most states, construction job losses during 2020 were 10% or less. And second, construction employment rebounded strongly in all states by about September. In fact, by the end of last summer, the least impacted group of states, shown here in light orange, actually showed job gains relative to pre-pandemic levels. Let me close by noting that the employment story for manufacturing is similar to that for construction through 2020 and to date. So while many jobs are still missing in service sectors like leisure and hospitality, the outlook for demand and employment in construction and manufacturing is very positive. To be sure, both of these sectors are facing material shortages and supply chain bottlenecks, but those are likely to be temporary. So looking ahead, both construction and manufacturing appear to be back on, or close to, their pre-pandemic employment trajectories.
So as you've shared, these two highlighted industries have had different challenges and have different paths forward in 21. It's worthy of mentioning that the sectors that could switch quickly to remote work, financial services, information technology, and insurance, lost little employment in the pandemic. In terms of job losses, these sectors, like many of you that are with us today, were mostly unscathed. So I'll echo some of Len's themes for 2021. I heard you say rebound, optimism, and hope, and growth, despite the surprising April jobs report. I'm sure we'll come back to that in our Q&A. So thank you, Len, for sharing these insights today. Keeping a close eye on the economic recovery is at the top of our watch list for 2021. And tomorrow, industry economist Bob Hartwig will share his perspectives of the pandemic's impact on the economy in 2020, specifically on workers' compensation and the P&C industry. Now I'll fill you in on a few more details for workers' compensation premiums, and then move on to other parts of today's story. Let's focus our attention on the change in direct written premium across the NCCI jurisdictions. At the bottom of this slide, the private carrier change in direct written premium was a decrease of 6.6% between 2019 and 2020. We just described the payroll story of employment and wages offsetting each other to a large degree. And here you see that changes in loss cost is another major driver of the change in direct written premium. Again, we're not surprised by this as well because this is driven by the continued profitable experience of the line. Here you see the changes in bureau premium levels over time, reflecting approved NCCI rate and loss cost filings. After a few years of nearly 10% decreases, the weighted average decreases have tempered some, and the 2021 loss cost decrease is approximately 5.6%. And when you look at the most recent round of experience filings by individual jurisdiction, you'll notice a few increases, notably Hawaii and Alabama. We also have a few double-digit decreases, but fewer than last year. And the standout here is Virginia. So Virginia's experience is strongly influenced by the medical fee schedule implementation that occurred in 2018, and correspondingly, the experience has improved significantly. The overall range of filings from top to bottom continues to tighten. The next part of our story is workers' compensation results, and we'll start with the calendar year combined ratio. So as you saw in the beginning, the financial highlight here is the 87% combined calendar year combined ratio for 2020. It's less than a 2-point increase over 2019. And with this historical view, you continue to see the strength of the line. And we now have 4 years in a row with combined ratios under 90. And I'll remind you that calendar year results are impacted by adjustments to reserves on prior accident years. The low calendar year results for 2019 and 2020 are indeed impacted by reserve releases, which reduce the combined ratio. So this 2020 result translates into a 13-point underwriting gain, a metric of financial strength. And we had an underwriting gain for many consecutive years, as you see here. If we break the combined ratio into its component parts, you can see that there's been a slight uptick in the most recent year in the loss ratio in blue. And what this means is that losses dropped in a similar proportion to premiums to keep the overall combined ratio in the upper 80s, despite this year's COVID-19 claim activity. And even with the small loss ratio increase that we see here for 2020, this is the 4th year in a row with loss ratios under 50%, which are the lowest we've seen in at least 3 decades. In purple, you see a bit of a decline in the 2020 loss adjustment expense ratio. It's primarily due to carrier reserve changes, causing the 2019 ratio to be relatively high and the 2020 ratio to be relatively low. So we look at a longer-term average, and a 4-year average for loss adjustment expense is about 13% of premium. Next, we see the investment gain on insurance transactions, and it comes from the NAIC annual statements. This separates investment gains into gains from insurance transactions and those from capital and surplus. And our preliminary estimate here for 2020 is 11%, slightly higher than last year's result, still below our long-term average of 12.2. So overall, investment returns have been pretty favorable, considering the low interest rate environment in 2020. So the 11% investment gain plus the 13% underwriting gain results in a 24-point operating gain for 2020. 4th straight year with results over 20%. Highest gains we've seen going back at least 3 decades. Now let's broaden our results discussion by looking at accident year results. The financial highlight here is that the accident year reported combined ratio for 2020 is 100%. This is reported by the private carriers, reported in their NAIC annual statements. So for reference, we show the calendar year combined ratios here in blue. And the orange bars are the accident year results, and we haven't seen 100 in quite a while, since 2012. It's also worth noting that COVID losses are included in the 2020 figures here. Let's take a different look at the accident year results. Here, the carrier's experience is shown in the darker orange bar. In the lighter orange bar, you see NCCI's estimate of that year's ultimate combined ratio. So in other words, NCCI's estimate is where we believe each accident year will ultimately develop. So similar to prior years, our estimate is substantially below the carrier's reported combined ratios. Our estimate of 2020 accident year is 89, 11 points better than the carrier reported experience. Here you see the loss and loss adjustment expense ratios by accident year. This is the same format as the previous view, just removing the expense ratios. Carrier reported is in darker orange NCCI selected is the lighter orange. First, let's look at accident year 2019. The 69 here in darker orange represents the carrier's current view of accident year 2019. It is already 2 points lower than our first look at 2019 1 year ago, and it's on its way closer to our NCCI estimate. It's a pattern that we've seen for many years and one that persists. Based on our analysis, it looks like carriers are reflecting COVID uncertainties in their ultimate accident year 2020 loss ratio of the 73 you see here. But now look at NCCI's estimates for the 2019 and 2020 accident years, again in lighter orange here. Our estimate for 2020, which includes the COVID loss activity, is holding steady at 61%. So we recognize that any analysis of the 2020 accident year carries more uncertainty than usual due to COVID. With such significant changes in losses and premiums, distortions can occur. So we've supplemented our analysis with additional diagnostics to detect and understand the anomalies. At the aggregate industry level, we are seeing a remarkably stable loss story. And as I mentioned, COVID's impact on the results is included in these 2020 figures. So far, based on what we've seen, we believe COVID losses will account for about 2 to 3 points on the overall 2020 accident year loss ratio. And we'll provide much more detail into the COVID losses shortly. Let's look at workers' compensation reserves next. And I'll remind you that bars above 0 in this view are reserve inadequacies, and bars below 0 show reserve redundancies. And as I mentioned earlier, this is also one of our key financial highlights. This year's analysis continues to show that the reserves held by private carriers are redundant, and that the redundancy has grown to $14 billion at year-end 2020, despite the calendar year reserve releases. So the results show that the workers' compensation system is withstanding the COVID challenge, despite the premium declines. The line continues to enjoy a strong financial position with a robust reserve position and solid underwriting profitability. So let's take a broader look at and connect the dots on how workers' compensation fits into the broader property and casualty industry results. If you look at the bottom here, property and casualty net written premium 2020 is nearly $649 billion, an increase of 2.3% over 2019. Most lines saw increases, up to 13% increase for other liability. That includes general liability, product liability, umbrella, and excess liability. And personal auto saw a modest 2% decrease. For our line, the only line with a direct link to employment levels, this decrease stands out. Here's a view that highlights the renewal price activity across several P&C lines. It comes from the CIAB Market Index Survey. And this is a quarterly view across a 3-year period from 2018 to 2020. And you can see how premiums are shifting upwards over this time period. For workers' compensation, highlighted here in blue, renewal price change has turned positive for the last 3 quarters. And commercial auto, it's consistently experiencing 8 to 10% for the last several years. General liability, renewal price climbed through 2019, but appears to have stabilized a bit in 2020 with 5 to 6% increases. And umbrella has seen significant renewal price change in 2020. We see approximately 20% in the last several quarters of 2020. Now let's take a look at the profitability of the P&C industry. And at the bottom here, you see that the 2020 overall combined ratio for the property and casualty industry is 98, a 1-point decrease from the prior year. Property lines show increases to combined ratios, but this is largely due to 2019 being an exceptionally light catastrophe year. Not surprisingly, personal and commercial auto saw their largest reductions in combined ratios in 2020. It's driven predominantly by the miles driven, reduced miles driven across the United States, and lower frequency. And as for workers' compensation, our 87% has changed slightly, but you see here that workers' comp continues to be the most profitable line of all the property and casualty lines of business. Our last view for the property and casualty industry is a long-term view of industry combined ratios. And it's clear that carriers have continued to stress the role of underwriting because we see here an underwriting profit in 6 of the last 8 years. You have a sense of the big picture of workers' compensation results and the overall P&C results. Now let's start our look into loss drivers by focusing on COVID-19 losses. So recall the financial highlight I mentioned. We have reported losses to date of $260 million for NCCI states, private carriers, and state funds. We're going to share a whole bunch more insights. First, let's take a step back and put the COVID exposure into perspective by looking at some population stats. Our total U.S. population is about 324 million people, and about 80% of that are working age, older than 16 years old. That's about 260 million people. And the employed portion of this in a typical pre-pandemic year is just under 50%, or 160 million people. I'll pause for a second. Remember the fear and uncertainty from last year. With executive orders and legislative presumptions, there was tremendous uncertainty about the breadth of compensability and workers getting COVID on the job. Uncertainty about infection rates, report rates, hospital capacity, all were looming over our country and looming over our industry. And returning to work was also an unknown that could impact who was at risk. And at that time, we felt that all workers could be at risk. But if we focus on the most exposed worker population, we focus in on healthcare, first responders, and other essential workers. And these groups represent about 14% of the U.S. population, or 45 million people. This is across all states, but it helps to put the exposure into perspective. Who was at greater risk? Healthcare and first responders carried out that vital mission of caring for COVID patients. And the other essential workers focused on keeping society moving. With that as a backdrop to our COVID story, I now introduce NCCI's Nadej Bernarda-Renz. She will share our insights for COVID-19 claims, starting with some additional summary stats.
Thank you, Donna. Let's start with the $260 million in incurred losses you mentioned earlier. The losses are coming from 45,000 claims, and these claims have some type of payment or reserve associated with them. The average severity of a COVID claim is about $6,000. And when we look at claims with an indemnity or medical component, the majority of those are lost time claims. The data that we're sharing today includes both large deductible and non-large deductible policies. So this is truly our first view at all COVID-19 claims for accident year 2020 valued as of year end.
We've been waiting for this data for a long time to see it all come together. So Nadej, as we look back over the year, Len talked earlier about the economic activity related to the 3 big surges in COVID cases. Let's see how those surges impacted our loss activity in 2020.
So here you see the 3 surges in the CDC data for 2020. The first surge peaked at 42,000 cases per day back in April, while the last surge increased significantly in intensity and peaked at 250,000 cases per day. When we drill down on the CDC data, the combined NCCI states showed the same exact pattern. And this pattern is also consistent when we look at different age groups. Now, there are probably many factors influencing the increase in intensity we're seeing here, one of which could have been more access to COVID tests. A second could be due to family gatherings that occurred during the Thanksgiving, Christmas holidays. But when we think about it, both of these factors may not necessarily translate into more workers' comp claims. Because when you look at the workers' comp COVID claims reported for the 38 NCCI states, You see the same three surges, but the peaks were fairly consistent, and all three peaked at about 300 claims per day. Now, we may see claims reported in early 2021 that actually happened back in December, but we did not see a spike in COVID workers' comp claims that match the intensity of the broader population.
It's overall good news for the workers' compensation system. I'm so glad we didn't follow that spike up in the fourth quarter. We've connected, and we've had the opportunity to connect with numerous carriers throughout the year and other respected industry sources to see if our results were consistent with others. And these sources include independent bureaus in addition to state departments of workers' compensation. And some of these have been sharing their data consistently throughout the pandemic, like the Florida Division of Workers' Compensation. We also compared to claim administrators' reports, such as the recently published Mitchell report, and that includes self-insureds as well. So we compared average claim size, types of claims, and which workers are injured. So the information we're sharing here today is a strong representation of the industry. Let's start by looking underneath the average claim size, since it's significantly lower than the typical workers' comp claims. But let's first look at claim type.
So if we look at the workers' comp claims before the pandemic, they were heavily med-only weighted. Typically, 75% were med-only, while 25% were lost time, those shown in blue here. With the COVID claims, it's flipped. We see a much smaller share of med-only claims with an average severity fairly similar to the pre-pandemic value at $1,000. The second group of claim is the indemnity only in the light blue. These claims have no reported medical losses. These could have been folks that tested positive and showed mild to no symptoms. Therefore, they required no medical interventions. We typically refer to them as short-term wage replacement type claims. The average severity for this group is slightly above the med-only at $1,700. The last group of claim is fairly similar to the typical lost time claims. They have both an indemnity and a medical component. The average severity is at $18,000, half of what we typically see for a standard lost time claim. This is where we see the more severe COVID claims. As I mentioned earlier with COVID claims, the distribution flipped. You can see that most COVID claims have some type of indemnity component in blue here. We didn't see that prior to the pandemic.
So safe to say most COVID claims are small. So let's show a simple size of loss distribution next.
We'll start with the smaller claims first. Over 60% of COVID claims are less than $1,500. Most of these are the med-only and the indemnity-only claims we mentioned earlier. If we add the three blue bars here, you see that 95% of COVID claims are under $10,000. It's actually encouraging because one would anticipate that these claims might be more manageable in the system. However, there are significant and severe claims as well. Let's go to the bottom of this chart here. Claims above $100,000 account for 1% of total COVID claims, but yet they contribute to over 60% of total COVID losses. As you can expect, majority of these claims were still open as of year-end. These claims were far more likely to have some type of inpatient hospitalization. On average, the claimants tended to be older than the overall average age of a COVID claimant. They also experienced more complications due to treated comorbidities, and they were far more likely to be treated for multiple conditions.
So clearly, these claim characteristics that you mentioned are contributing to these larger claims, more tragic claims. And it's here that we can expect possible long-term COVID symptoms that create potential long-term concerns for workers' comp. Tomorrow, our colleague, Raji Chattaravian, will look at other escalating claims for insights about how COVID-19 claims may escalate. Nadej, while the early data doesn't identify each claimant as a nurse, a doctor, a grocery worker, a delivery driver, it does provide us with some general industry classes where we can see the context of these reported claims. Let's share that detail next.
Sure. When we drill down on the data, we notice that majority of the COVID claims are coming from the most exposed workers you highlighted earlier. In fact, Healthcare and first responders make up 75% of COVID claims. And if we look at the healthcare workers, the people that are working in the nursing home, these folks are taking care of such a vulnerable population. They make up more than a third of the claims. Other healthcare, the hospitals, the physician offices, they're just about another third. A lot of the first responders are self-insureds, but we still see a number of first responders claims from the private carriers and state funds. If we shift our focus to the light blue here, these workers are commonly referred to as our other essential workers. They make up about 15% of COVID claims. The claims are coming from workers in the restaurants, building operations such as janitors, the distribution system, and retail store.
So together, the frontline workers, the healthcare first responders, and these essential workers make up 90% of the loss activity we've seen to date. So plenty of uncertainties remain. So let's talk about some of our primary watch list items.
You know, despite what we know, there's still a lot of uncertainties for sure. We have great industry concern about the potential for permanent disability. Historical data shows that some lung and other infectious disease claims develop into permanent partial and sometimes even permanent total claims. We've seen many articles suggesting a notable prevalence of long COVID, also known as long haulers. And even those with mild symptoms could become long haulers. We're also concerned with possible neurological and psychological challenges that could come from COVID.
And the COVID variants and future surges are also concerning. And how will these impact future claim activity? Yet we have expectations that the vaccines will curtail claim activity in 2021. Yet at the same time, we have businesses that are resuming more normal activity. So lots of uncertainty exists. So thank you, Nadej, for sharing these insights today. It's safe to say we will continue to analyze the data as it comes in, and we will continue to collaborate with others in the industry. So let's shift to the traditional loss drivers for workers' compensation frequency and severity. For these views, we will highlight the metrics excluding COVID losses, and we continue to treat COVID as an extraordinary loss event. So excluding them here is consistent with that treatment. NCCI estimates that the lost time claim frequency for accident year 2020 will be 7% lower than that for accident year 2019. This compares to the long-term frequency decline of 3.9%. So 2020 is clearly an anomaly. Pandemic-related shutdowns and increased use of telecommuting are likely contributors to this larger-than-average decline. Estimating the change in medical severity is a little bit more challenging. At this early stage, we have a lot of uncertainty about how medical claims in 2020 will ultimately develop, and we're calling it plus or minus 2%. Pandemic-related impacts have caused shifts in the data. Shifts in overall percentage of medical-only claims, shifts in the distribution of workers' comp claims by injury type, and shifts in the utilization of hospital inpatient facilities. This medical severity change is lower than what we've seen in the recent past, and we believe it's possible that medical severity may even decline in 2020. And while one may have expected delays in time to treatment to have been a contributing factor to this modest change in medical severity, we haven't seen any evidence of shifts in this area. And tomorrow, NCCI's Barry Lipton will dig deeper into time to treatment issues with insights that look beyond the surface. So we watch the medical lost time severity and how it tracks with our medical inflation metric. The metric is the Personal Healthcare Chain-Weighted Index. So here you see the blue line is the cumulative change in medical lost time severity, and the orange line shows the cumulative change in the index. Looking back over this time period, 20 years, medical lost time severity in NCCI states has grown more than twice as fast as the medical price inflation. But over the last 10 years, it has generally tracked closer to the growth in medical care prices. So for 2020, there's nothing to suggest here that the costs have deviated from this inflation metric. Moving on to indemnity. Our estimate for average lost time indemnity claim severity for the accident year 2020 will be 3% higher than that for accident year 2019. And this is generally consistent with annual indemnity changes that we've seen recently. We also track average indemnity severity against a cumulative change in average weekly wage. Here you see the blue line represents the cumulative change in indemnity severity. The orange line shows a cumulative change in the average weekly wage. Both are indexed back to 2000. And here you see that the change in indemnity severity continues to track quite closely with the change in average wage over this time period. Again, I'll highlight, we excluded COVID claims to best understand the true loss drivers for the system. And it's safe to say there doesn't appear to be any major concerns in these trends. As part of the State of the Line, we want to share legislative and regulatory perspective. So let me introduce NCCI's Sean Cooper.
Thanks, Donna.
Nice to see you. Sean, we have a variety of things to discuss, but first, let's talk about the NCCI Indemnity Data Call, which will be helpful in understanding the impact of future regulatory and legislative changes. So Sean, you and your team were highly engaged in this effort from the beginning. It came to life in 2020, and we're just starting to leverage it. Let's provide an update on the call.
Sure. It's a really great tool, Donna, and the primary purpose of NCCI's latest data source is for legislative analysis, and the industry's really stepped up to make it a reality. Data collection started in the middle of last year, and what's interesting is that the indemnity data collection aligned very closely with the start of the pandemic. This means that most lost time COVID claims will be captured in this transactional indemnity call. Now, we've leveraged the data already in COVID-related research, and our legislative analysis teams have consulted this data to gain insight on presumption legislation. By linking this data with our other data streams, it's helped to enhance the quality and the depth of the information that we share. This expands the boundaries of our research and improves our ability to analyze legislation.
I think the carriers deserve a really loud shout out for their support and commitment to sharing the indemnity data. We will reap benefits of this investment for many years to come, as it allows us to provide the deeper levels of insights to the industry. So let's move on to the regulatory and legislative actions of 2020. And policymakers had some difficult challenges to guide the pandemic response. And the first one is telemedicine. Policymakers had made changes to allow for the greater utilization of telemedicine capabilities in 2020. How did they do that?
Well, pre-COVID, telemedicine wasn't used very much in work comp, largely due to legislation, regulation, and HIPAA privacy concerns. But during the pandemic, emergency orders and permanent rule changes expanded telemedicine for work comp. We saw more technology being authorized. Don, I think we both had telehealth visits using FaceTime on our iPhones. I think it was the very same week, actually. Before the pandemic, prior written consent was needed before a telehealth visit could be done. Those rules were suspended. Reimbursement rules were also modified. In some cases, the payment was the same as for in-person. In other cases, the carrier and the provider negotiated reimbursement levels. And CMS, they expanded the range of services that could be provided via telemedicine. Now, the main driver is the easing of rules around interstate licensing. But essentially, access to remote care via telemedicine has expanded significantly, and it'll be a much more viable option going forward.
So these actions to make it more viable came to life in the second quarter data. We saw a sizable increase in telemedicine utilization when access to care was extremely limited. So for example, we saw for typical office visits, we saw telemedicine usage jump from 1% in first quarter to 11% in second quarter. But as clinics and hospitals started to reopen, the usage slipped back a bit to 4 to 5%. I think it's safe to say that the technology solutions that were enabled in 2020 are indeed game changers. And I agree with you, we expect the utilization to increase in the years ahead. Let's transition to the second regulatory challenge in 2020, and that is the compensability question. Policymakers stepped in to clarify coverage in many states. So let's start with the 2020 activity and how did that impact the 2020 loss outcomes?
Our map here highlights presumption activity in 2020. The 9 states in darker blue passed presumptive legislation, but several other states, shown in orange, implemented presumptions through executive or emergency orders. Most of the presumptions in 2020 focused on healthcare workers and first responders. This next chart shows the ratio of lost time claims that are COVID-related for NCCI states. The states with presumptions are shown in blue, and they tend to have a higher share of COVID claim counts. Kentucky stands out, and it's worth noting that the Kentucky order provided a broader presumption for workers that had exposure to COVID. Now, Kentucky workers just needed to have exposure to COVID for the presumption to apply. They did not have to test positive. Across all the NCCI states, COVID claims represent roughly 7% of lost time claim counts and a relatively smaller percentage of reported claim costs, less than 2%. Now, the 2021 legislative sessions are pretty much behind us, but we saw presumption discussions continue in many state capitals. For the states that enacted legislation last year, 7 of those states saw legislation to extend or expand their COVID presumptions, and 3 of those states actually passed a bill. Now, another 16 states saw new legislative proposals for COVID presumptions, and 2 of these states enacted its legislation. As was the case last year, the 2021 presumptions have generally been retroactive to the start of the pandemic, and several of the bills in 2021 have expanded the scope of workers that would be covered by its presumption.
Our last area to discuss within the legislative landscape is mental health. Clearly, COVID has taken a toll on the mental health of many workers, and it's appropriate to keep this in the forefront to ensure that the system is addressing worker-related mental health challenges. Past legislation is focused on PTSD for first responders. Let's talk about these challenges and the legislative landscape as it stands today.
You're right. Mental health continues to be an issue, and when we think specifically about work comp, someone who's diagnosed with PTSD doesn't usually have a physical injury. In fact, any claim involving mental treatment with no physical injury is called a mental claim. There's been increased activity in recent years to broaden PTSD coverage, particularly for first responders. As far as mental injuries go, coverage varies dramatically by state. Some statutes specifically exclude work comp coverage for mental claims, shown in orange. For the states in blue, their statutes specifically include this coverage. The other statutes are silent, but there is emerging case law in nearly all of these states. When this coverage is provided, it's often limited. One example is where coverage applies only to specific workers, like police officers or firefighters. Due to the extended duration of the COVID pandemic, we're keeping an eye on whether there could be PTSD or CTSD, that's continuing or continuous traumatic stress disorder for healthcare workers. And what about other essential workers who may have experienced anxiety from going to work during the pandemic and were worried about possibly infecting their loved ones when they got home each day from work? They may not have contracted COVID, but the stress they were facing is work-related. And then there are the workers who did contract COVID. Nadej alluded to this earlier, but a recent study showed that 1 out of 3 people who contracted COVID had a psychological or neurological condition 6 months after contracting the virus. More study is needed to understand the potential implications of that data on workers, but it highlights another area where mental health coverage related to COVID may be needed. Ultimately, the legislatures and the courts, not NCCI, decide when work comp is the vehicle for providing mental health coverage. Mental health is a recognized need for our workers, and there are options for providing that care, including wellness programs and group health coverage.
So mental health in general has become such a pervasive topic across all of our lives. It brings me back to our theme of stronger together, because all of our workers' comp stakeholders and policymakers can influence how society responds with additional types of support. Thank you, Sean, for your legislative and regulatory perspective today. Later this afternoon, you'll get additional regulatory perspective from NCCI's Susan Donegan and the Arkansas Insurance Commissioner, Alan McLean. That's right after our Q&A session on the state of the line. So now you've gotten a lot of information about the state of the line, and I'll summarize quickly. Here are the highlights I discussed at the beginning of the presentation. As we've seen, the workers' compensation system remains strong. Premium was down in 2020, and the workers' compensation line of business posted another calendar year of historic underwriting results. Workers' compensation reserves remain strong. Claim frequency fell during 2020. We expect moderate changes in both indemnity and medical claim severity. And our first look at COVID losses is $260 million, much less than we feared at this time last year. Let's quickly recap the issues that we're watching most closely. Safe to say, COVID is at the top of the list in 3 different ways. From an economic perspective, how will COVID infection variants and future surges impact the recovery? How much volatility might we expect from month to month in job recovery? And how fast will economic recovery translate to workers' compensation recovery? From a COVID loss perspective, how will vaccines impact 2021's experience going forward? And how will we manage the permanent disability or long COVID conditions? And from a regulatory perspective, how will some of the retroactive presumptions considerations impact loss development for accident year 2020? All in all, is 2020 purely an anomaly, or will there be lasting effects? These are the issues we will be watching in 21. So you can get this presentation and additional background materials, including the State of the Line guide, at ncci.com. Those materials are there right now. Clearly, this is a team effort to deliver all of this to you. Please join me in a final shout out to the great work of the NCCI experts who you've seen, and dozens behind the scenes, who do the hard work of evaluating, analyzing, planning, and sharing all of this information on the workers' compensation system. It's a great team, and I deeply appreciate their passion and commitment. Thank you. We want your questions. You have a few final moments to send them our way. I'll bring back our NCCI experts, Len, Nadej, and Sean, to assist in our responses. So let me put the state of the line into perspective. What's very clear today is our workers' compensation system remains strong. Despite the premium setback, we have historic levels of profitability and reserve strength. No doubt, we will have new challenges in the months ahead. The pandemic isn't over. But our frontline workers continue to be the backbone of the response to this crisis. So let me offer one more. I guess the last one wasn't final. One more final shout out to our frontline workers. Thank you. Your strength and commitment is so greatly appreciated by the country. So all of us here today have a vital role to play. Together, we support and sustain the workers' compensation system that serves workers and employers across the country. And we've had a difficult year. But whatever your role, medical provider, underwriter, claims adjuster, risk control expert, actuary, agent, broker, regulator, independent bureau, or you're part of the NCCI team, we've made a difference in the past year, and we are emerging from the pandemic stronger together. Welcome back. Now that was a quick break. Quick for us up here. So first, I'd like to start by thanking you for your questions. We have so many of them, And that means we're going to do a little bit of speed dating, I think, to get to as many as possible. So we're going to get right to it. But just a fair warning, we had some common themes coming through as well. So my team here grouped some questions. So if your question isn't exactly worded the way you sent it to us, we're trying to get to as many as possible. So first off, first things first, Len, we talked about it. April jobs report. It came as a surprise when it was released last Friday, I think for many of us. And the headline I saw that job creation was a miss, a disappointment, and things like that. There's all kinds of words that can describe it. Is the job recovery starting to stall out, in your opinion?
Thanks, Donna. And when we talked about it before, remember I said that the jobs report was not so surprising and not so worrisome. Well, I chose my words carefully because I knew you were going to make me defend them, so I'm going to try to do that now. For unsurprising, let's look at the numbers. Now, the actual increase in private non-farm employment, I'm going to be a little bit technical here, but the numbers look like this. In March, there was an increase of 708,000 workers in new employment. In April, 218,000. So 708 about here, 218 about here. That looks bad. It looks like hiring fell off a cliff. And most of the headlines you saw, and I'll paraphrase one here, it's similar to a variety of others. It sounds like this. Economists were expecting 1 million new jobs in April, but the April jobs report showed that companies only added 266,000. Now, there's a minor technicality here. I said 218. That's because people are typically quoting non-farm employment. I'm doing private non-farm employment, but the story is going to be the same. 218 versus 266. There's still a big drop-off. So does that mean that hiring stalled out? It doesn't, in fact. Now, the actual increase in private non-farm jobs looks like this. In March, it was 1,050,000. In April, it was 992,000. Okay, so what's going on here is that actual new hires are very similar, almost identical, in March and April, and both months are actually above or at 1 million new hires. That's a very different kind of a story. And the issue between the two stories has to do with seasonal variations, or the idea of seasonal adjusted employment. And that's something that's often overlooked. Now, in simple terms, when we talk about seasonally adjusted employment, we're talking about the excess of new hires beyond expected seasonal variations. This is the same concept we get at with our employment gap. But the key thing is here, starting in April, this is the beginning of the spring to summer shoulder season. Seasonally, you expect to see big hiring ramps in a variety of industries, construction, leisure, and hospitality, among others. Therefore, what's going on is that a lot of new jobs were created, but because these were in line with seasonal expectations, they get netted out. They don't get counted. Okay, so in fact, a lot of new jobs were created. Hiring didn't fall off a cliff, but if you look at seasonally adjusted data, it doesn't look that way. Now, that's the not surprising. As far as not worrisome, let's drill down into some sectors. Leisure and hospitality in actual jobs added 575,000 in April. That's well above March's actual number and actually well above the seasonally expected increase for April. So leisure and hospitality, our hardest hit sector and emblematic of the COVID recession, actually did very well in April. Now, construction, too, added 170,000 jobs, but this was just equal to seasonal expectations. So in seasonal adjusted terms, it came out at about zero, and that really underscores the difference. Now, where did we see actual shortfalls, either in absolute numbers or relative to seasonal expectations? In order of magnitude, these were in transportation and warehousing, retail trade, business services, and manufacturing. Manufacturing, as you know, having issues with supply bottlenecks. And the BLS employment situation report specifically related that employment declines they were seeing related to temporary help services and couriers and messengers. Now, that message is not really inconsistent at all with the idea of a strong economic recovery ongoing. So Not surprising, not awful, not worrisome. I stand by those viewpoints.
In your opinion, and for leisure and hospitality, I think it's good news in April. We have to be mindful of that. All right, so let's go to another question here. We're going to switch over to COVID and the claims that we've seen. So Nadej, this question is going to be for you. You mentioned that 75% of the COVID claims have some type of lost time indemnity component. Can you describe what claims are included in this analysis? And I think we had several questions here, just clarifying the content of our data that we're seeing. So Nadej, can you just share your perspective?
Sure. So the claims that we're looking at are really focused on NCCI states, first of all, for private carriers and state funds, so no self-insured data included. The 75% of the COVID claims that we mentioned that had some type of lost time component, those are claims with either a payment or some type of loss reserve. So if we didn't have any kind of loss reserve or payment, those claims are not included in our analysis. So that was probably an easier one than Len's, obviously.
Excellent. Sean, I think I have one next one up is for you. From your presentation, it appears that a considerable number of COVID presumption bills have been proposed in 2021, but have not been enacted. Are there major bills that may still be debated or passed?
Yes. Well, after our slides were finalized, Alaska actually enacted its proposal to extend its COVID presumption until the end of 2021. In terms of other COVID presumptions not yet enacted in other states, only a handful of those have made it from one legislative chamber into the other. But I wanted to just make one other point, since I talked about mental claims earlier in the presentation today. I wanted to just point out that Connecticut actually has a proposal which would extend its mental health coverage to include PTSD for healthcare workers that were impacted by COVID. So I'll just stop there.
Thank you. So this next one I'll take. So during our presentation, I mentioned the changes in lost time claim frequency and severity excluded the reported COVID-19 claims. How would those estimates change if the pandemic-related claims were included? So keep bringing your mind back to what I said about frequency. Frequency was -7% year over year, 2019 to 2020. And that decrease, because there's an influx of claim activity for COVID claims, actually comes up to about a -2. So it's still in line with our long-term overall decline, but just not quite as deep. So the -7 of excluding COVID claims really does recognizes the fact that we were doing telecommuting as well as the business shutdowns. And so for severity, medical severity and indemnity severity, both of those, if you include the COVID-19 claims, both of them have downward pressure. So it's making those both numbers, the 3 for indemnity severity becomes something like number 1%, and the plus or minus 2% on medical severity change actually pushes that more negative. So the next one, Len, this is going to go back to you. We're trying to distribute across my friends here. Even as employment is starting to recover, a lot of employers are reporting difficulties of filling open positions. And how do you explain this?
This is a question that we've gotten in several different ways, and it's one that people feel strongly about. However, I think it's also one where a good answer is rather nuanced. So let me start with kind of a high-level theory point of view and then move into some of the data. Now, coming out of the COVID, it is contradictory. It looks odd, right? That you've got a lot of vacancies, you've got people still, a lot of them out of work, and yet employers are reporting difficulty filling those vacancies. Here are some of the points to consider. First, it's a lot easier to go into a recession than to come out of it. To lay someone off, you simply lay them off and that's that. But to bring someone back requires mutual agreement. And this is not quite so easy. We saw in the Great Recession, for example, and in building trades, that certain specializations like electricians had moved on to other types of opportunities and were not looking for electrician jobs. This can be happening too. In the current recession, you can have people moving on to other types of jobs, people moving out of areas. It's also true, and we see this in survey data, that the terms of accepting employment in the post-pandemic world are different than in the pre-pandemic world. Let me explain. For a lot of women, for example, predominantly women, then the absence of childcare, daycare facilities or schools being closed makes it difficult for them to take a job that they would have taken pre-pandemic. There's also a concern among many workers, potential workers, that they would be exposed to COVID infection in the workplace. Now, whether this is real or perceived, it is real to those workers. So that plays into a decision. Now, I'll emphasize, in the spirit of hiring being a bilateral decision, that when employers are saying they're having difficulty filling open positions, it often means at the levels of pay or under conditions that prevailed pre-pandemic. Post-pandemic, things can be different. So it may be possible to fill some of those positions by raising pay or by changing work conditions, and indeed many are doing this. Now, the point I saved to last has to do with the federal supplement to unemployment insurance. This is the $300 supplement beyond state benefits, which runs until September. Okay, so it's $300, it's temporary. Unquestionably, receiving this extra money makes it easier for workers to defer taking a position for any number of reasons. It's also true that the impact payments have a similar kind of effect. All right, so first I'll note that this is a temporary thing. It goes until September. I think the bigger question here, and it's certainly playing on the minds of employers, are there going to be permanent changes that outlast this temporary unemployment insurance benefit, that influence their ability to hire, that influence the terms of employment, that differentially impact different types of occupations? That's the first that's the first situation. That's the first comment, and I think that I see this as being primarily a temporary kind of a condition. I think that we need to take into account all the different factors that are contributing to it, and we will see how it plays out by year end.
This is just definitely a multi-dimensional challenge that we have ahead with this recovery, for sure. So thank you for that response. Nadej, I think I have one up here for you next. Are you surprised by the number of COVID-19 claims?
It was tough to know how many claims we would have, right, at the beginning of the pandemic. We saw that our frontline workers bear the brunt of the claims. Healthcare workers, first responders, and the other essential workers, they bear the brunt of the claims. We were fearful at the beginning of the COVID pandemic. We weren't sure exactly if we would see the worst case scenario, and we're thankful that we didn't necessarily see the worst case scenario. I think some of that could be due to a lot of us moving away from working from the office to home. A lot of employers acted pretty quickly to take in CDC guidelines and also protect their employees with PPEs and all sorts of things. So thankful, grateful, but also hopeful that we'll see a lot less claims in 2021, right?
Definitely. So I think we also got some questions about just the breadth of our COVID data. And we said we had $260 million of losses activity. And there was a question about, is that for NCCI states? And we said, and the answer to that is yes. And that is also for private carriers and state funds inclusive. So, it's interesting because when we look at just that number of claims, 45,000 is our number, and you relate that to the number of workers, right? I showed you earlier about that perspective slide, and it said 45 million in the most exposed worker classes. If you try to look at the NCCI state portion of that, it's about 55, 57%. So it's of 25 million people most exposed in our country. And we see 45,000 claims. I'm surprised by that too. I'm really surprised. I have another question up here I'm going to take. So it says, can you give a little more detail on the change in the reserve redundancy between this year and last year? And we have a complementing question about the difference between the accident year reported losses and our NCCI selections. So I think the response to this challenge is that accident year 2020, as reported by the industry, is indeed 100%, as reported here on that we showed on the slides. If you back up and look at what the paid loss dollars are, or the incurred loss dollars are for 2020, they're actually lower than 2019. So this, that kind of puts this idea of there's uncertainty that's included in the IBNR for incurred but not reported for the accident year 2020. So that's kind of how we kind of create that baseline. But then when we look at the NCCI selecteds, and that's how we determine what the reserve redundancy is, we are looking at that experience over time, and we have seen improvement in all prior years. So to the idea that says, is 2020 different? Will 2020 play out differently? We don't think so. And we've seen it in every single prior year. In addition to that, we had another question about our tail factors. And are we including tail factors? And we sure as heck are including tail factors in our loss development as we do this analysis. And yet those tail factors, as we do that analysis, it's coming down and being reduced year over year. And you can see that in our filing activity. So hopefully I've answered that question sufficiently. There's a lot to that one. Sean, the next one's for you.
Okay.
Ready? How likely is it that we will see continued or increased use of telemedicine?
Well, Donna, you touched on this a little. You mentioned how telemedicine usage ticked up quite a bit when we looked at the second quarter 2020 data, and then it tailed off somewhat in the third quarter. But although it tailed off in the third quarter, it was still continued usage, much higher than what we saw pre-pandemic. Now, looking at the fourth quarter 2020 data, what we have so far, it looks pretty consistent with what we saw in third quarter. So again, that's continued usage. But the data aside, another thing that I think about is just during the pandemic, how so many of us became more accustomed to using remote technology. We used it a lot, video conferences at work, but I even think about my mom, doing Zoom calls to celebrate birthdays and anniversaries and things like that with relatives across the country. So with many people becoming more accustomed to this type of technology, I think that's going to help to fuel the continued and potentially increased use of telehealth in work comp.
There's one commercial out there that's just recent, and it talks about the bandwidth on your Wi-Fi, creating a challenge to the experience of telemedicine. So all of those things are getting better and better and better. So it's something that I agree with you. I continue to agree with you. I think we'll see more usage. Next question. Nadej, I think this one is for you, and it's a tough one. It is a tough one. So are you able to identify the death claims from our reported data? And if so, how many have we seen?
So let's step back a little bit, Donna. It's unfortunate that anyone had to lose their life due to COVID. I wish there were zero claims, right? Sean mentioned the indemnity data call earlier, like we started collecting that early last year. And we're able to identify about 100 COVID death claims. Now, this is what's reported to date. I think that may not be the complete picture, right? So I think we need to wait for the unit stat data to really see what the complete picture might look like as far as death claims concerned.
And again, when we look at in perspective, I think the total is 580,000, more than 580,000 people who have lost their lives due to COVID. And in our NCCI states, again, we bring this back to our NCCI distribution and what we're looking, our experience base, there's more than 325,000. So with the number that you reported, I think the workers' compensation system has been lucky. We've been very lucky with the workers, and lucky, but it's awful, right? Mm-hmm. So again, staying on the COVID theme, this next question is back to me about my estimate that I mentioned about COVID on the accident year results. And I said it was 2 to 3%. And the question says, can you explain that further? So it's an estimate. Let's just be clear that it's an estimate based on what we know today. It's an estimate based on the $260 million of loss that we've seen. We expect loss development on that $260 million. And at this point, at an accident year that's 12 months old, we can expect that to nearly double. And then if we extrapolate that further, such that the accident year results are reflective of all states, I think that's where this comes from. 2 to 3% is on the accident year losses. So the next question is for Sean, you again. We're coming back to you on my right here. You discussed mental claims during the presentation. Is that term fairly common in workers' comp? And are there other types of mental claims that we should talk about?
Yeah, well, NCCI has used the term mental, and actually other experts in our industry have used it as well for many years. In terms of other types of mental claims, I guess I would say that there are three. So I described the mental during my portion of the presentation, right? A claimant that's getting mental treatment without a physical injury. That's what I called a mental claim. Another type is physical mental. So that's when a worker has a more common type of physical injury, but in addition to being treated for that, they're also being treated for some sort of mental health, such as maybe depression in terms of dealing with their injury. But then there's a third type of claim that's much less common, and that's what we would call mental physical. And that's when a worker has a mental condition that's work-related under work comp, but it manifests itself in a physical way. So those are the three.
Excellent. I'm going to go to Len next. So Len, the momentum in the economy seems to have shifted in a very positive way, right? You just described April, which, it was a little bit of a stall or we're still optimistic. What else could stall or reverse the positive economic momentum?
Well, Donna, let's go back to April for just a moment, because I'd like to reiterate that I think that April really was a positive jobs report. And in terms of actual jobs being created, we're seeing 1 million in each month. It's during a month, indeed a period of months, where we expect to see a seasonal ramp in jobs. I don't think it'll be too surprising if we don't beat that big ramp in a big way for several months, but merely meet it. We're also, and let me emphasize this, that in leisure and hospitality, the sector which has the biggest employment gaps now, we are seeing big job gains, 575,000 in April. And this is a sector where people earn low wages, where they might be most incentivized to stay out of work because of the extended unemployment benefits. Now, in the data, we are not seeing that that's having a big effect at the macro level. Hiring is occurring, hiring's happening there. So I think the story is fundamentally positive. Now, what can stall or reverse that? Well, this is the COVID pandemic and the COVID recession, and the COVID pandemic is continuing. In the QEB, we've talked about the idea that the COVID recession is delinking from the COVID pandemic. Now, it again seems counterintuitive because we have one because of the other. But the idea is that as we're going further along, the economic recovery is developing a momentum of its own. And if we use the winter experience, the third COVID surge, that big COVID surge, as a guide, we can see how strong that will be potentially. Because then we saw massive case rates and only a flattening in economic growth. Since then, we have COVID case rates that are more like they're about 1 point something million new cases per month, a lot below December. So in order to actually reverse the momentum of job losses because of COVID, I think we would need to see a very, very large surge. And with vaccinations proceeding, that becomes less likely. Now, in terms of bottlenecks, and we see big bottlenecks in chips, in lumber, others in other industries, these are going to retard economic recovery, but I believe, as many do, that these are temporary, not permanent. So I think what we want to be focusing on is where we're likely to be by year end, and I think that outlook is very positive.
Excellent. Thank you. So Nadej, I have one for you. Next one here is on the industry sectors. You described about frontline workers. Do the claim losses line up similarly to the claim counts?
Yeah, so I think this one is referring back to the slide that showed the healthcare first responders and the other essential workers. We decided to show the claim distribution, like claim count distribution, but if we showed the claim loss distribution, it would really show a fairly similar story. I'll highlight one notable difference. It's within the healthcare portion. The two groups that we showed the nursing homes, and we also showed workers that were in the other healthcare. So if we decided to show that by claim losses, those two would have been flipped, but they're very similar, right? Both of them are about a third. One is above a third and one is about 33%. So that would be the only notable difference that I would highlight as far as like claim count distribution versus claim loss distribution.
Excellent. Thank you. I'll take this next one. This one, and you guys can feel free to jump in because this is, I think it's a big, broader question about workers' compensation and the economic recoveries. So how will a speedy recovery impact workers' comp losses in 2021? So I'm going to start off by saying that this is, it's going to be a challenge, right? So speedy recovery, we've never probably experienced any kind of recovery that's happened like this, right, Len? So I think hiring, and it would be one thing if people were coming back to the same jobs that they had in 2020, but to the extent that they may not be, and they're going to different jobs or they found different jobs last year and they had to kind of transfer into a different work environment, then a new job with inexperienced workers could surely have an impact in raising our frequency in 2021. It could happen. We're not necessarily saying I'm expecting that, but inexperienced workers have tended to create some workers comp losses for us in the system. And everybody else is going to jump in on that one?
Well, let me just say a few words. We have a general understanding that going into a recession, that frequency tends to decline and then tends to recover, at least speaking relative to trend coming out of a recession. There are a number of reasons why this can happen. Donna mentioned one, which has to do with inexperienced workers. These are the ones who are most likely to be first laid off, and then they come back during the recovery. There can also be deferred reporting of workers' comp claims which are discretionary in the sense not that they're good claims, but that they can be deferred for some time. For example, you have a sore shoulder, you can work through it. You don't want to go out on workers' compensation. But coming back in a recovery, you're more confident and you can do that. So there is that kind of story. We'll have to see what it looks like in this recession, which is very different than ones we've experienced previously.
Excellent. Thank you for that additional comment. So thank you for those great questions, folks. While we couldn't get to all of them today, I know your questions are going to give us some insights into what we should be looking for in 2021 and beyond. So thank you for that, because it's great information for us.